All right, hello everyone, and welcome to SCO's July webinar on our SEO campus and clinical facilities. Thank you so much for joining us. I hope you all are staying safe and healthy. My name is Avery Cunningham. I am a Student Services and Admissions Officer here at SEO. I'm one of the admissions team members who answers your admissions questions and participates with you in the admissions process. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We will have time for questions towards the end of the webinar, but in the meantime, if you do have any questions or concerns that need immediate attention, please use your chat feature at the bottom of your screen to communicate with us. Today, you'll be hearing from two members of our SEO Ambassador cohort. As they're going to give you an abbreviated walkthrough of our main campus, the Tower, and our three clinical facilities, the Eye Center, which is our main one, and then our external clinics as well. And as I said, we'll have time towards the end for any questions you may have for either of these student ambassadors about the campus or about student life on the SEO campus. So our two ambassadors today are going to be Taylor Sousa and Alex McDonough. So let's see, I think Alex and Taylor are both here. So if you would both wouldn't mind introducing yourselves, and then we can go ahead and get started.
Hi everyone, my name is Taylor. I'm a second year student ambassador here at SCO, and I am from New Jersey.
Awesome. My name is Alex. I'm also a second-year ambassador, and I am from Canada. Grew up on the East Coast of Canada.
Wonderful. Thank you all so much. And before real quickly we get started, just to remind everyone that this webinar is being recorded and will be free and available to view starting next week on our website. And with that, we'll go ahead and get started with our first location, the Tower.
Yeah, so I'll be talking about the Tower. This is the home of the bookstore, the classroom complexes, as well as the um, optometry labs and research areas as well. So yeah, some facts about the towers that it was opened in 1970. There was a lot of renovations done in 2013 where a new classroom complex was created, as well as the clinic was changed locations as well. So this is the atrium. This is the second and first floor of the tower. This was renovated in 2013. The concept was to make it a student-friendly area where where students can interact with doctors and colleagues, as well as enjoy the natural lighting for breaks between classes or studying before midterms as well. This is also where the event of student organizations occur in the first week of fall semester, where all student organizations, such as all student organizations, promote each club, and it's a good way for students to get involved on campus and learn more about specific subspecialties of optometry such that they can further pursue after they graduate their fourth year, such as probably pursue residencies. In some clubs of those include vision therapy, so a neuro club, there's an ocular disease club, as well as private practice clubs, and as well as mission trip clubs to help the community as well. This is the optometric theory labs. This is where first year and second year students will have either the morning or the afternoon practicing their skills, learning on how to do a refractive sequence, learning how to deal with prisms, and also doing free space chair skills in their first year. And second year is more focused on evaluating ocular health and as well as learning certain skills such as gonio, fundoscopy, BIO. So as first year and second years, students will have access to the labs similar to library hours where they can go into lab and practice their skills as they want. And also sometimes students are there until nighttime where they can practice with their classmates before the day of a practical, for example, is when students show their skills that they've been practicing throughout the week to their proctors, and they receive a grade for that. First year and second year students are placed in lab groups where they um, will have exposure to many different classmates and different eyeballs by the time they graduate. And the setup is similar to the clinic where uh, the lanes are set up exactly like the clinic, so it helps the students transition from practicing on their classmates in theory lab, and so they can transition well to practicing on real patients. Here is the North-South Classroom, the new complex that was created in 2013, where students are spending most of their time in listening to lecture as well as taking their exams here. This is also where students will receive their white coat and go through the white coat ceremony after the end of their second year. Students here have new technology in front of them with the microphones that are installed. So students are encouraged to use a microphone so that everyone in the classroom can hear, as well as for it to be recorded on the feature that SCO has, which is Panopto. All the lectures are recorded so that students that weren't able to make the lecture for whatever reason, or if you want to go back and reference the lecture at a later time, students can hear the question and also hear the answer of the professor that has a microphone. One good feature about SEO is that the professors are also doctors of optometry, and they are um, it's a great resource. So during a class such as biochemistry, which is only optometry school, students can raise their hands and ask about how does a certain concept pertain to eye care, and how is it seen in clinic? And professors are usually really good at responding to that. So the North and South classroom is definitely also has other resources for students to also um, have work study opportunities as well. Students in every semester, they vote on anonymous notes, and the winner of that is a student that takes notes for the class and condenses the material. They are able to receive money for that, and in compensation, it's a very affordable price for the students to have access to those notes, and is an extra resource to have for when studying for midterms and final exams. So this is the Learning Resource Center. This is what SEO has, which is many people call it the computer lab. Students have access to these desktops to either study or have access to the printer or other programs on the computer, such as 3D anatomy models or study cases, ocular disease slides. Also, in the Learning Resource Center, there's the IT center where SEO has employees that help students with programs on their computers, and if they have any problems with technology, this is the place where students usually go and have that all resolved for them. This is the dining area and cafeteria for students. This was in 2020, there was a new partnership done with Square Meal. Students voted on this meal company to have more options and healthier options as well. Also in 2017, those booths on the bottom right were a part of the renovation program, where students can enjoy the natural lighting and have a more student-friendly environment to study and enjoy food as well on campus. And as well, there's many refrigerators for students to bring their lunches and also pack snacks for throughout the day. This is the library. This is the only designated quiet area on campus. Students are constantly using this area to study for midterms and finals. And this is another area where students can have work study positions, where they help other students and visitors navigate the library by using printers or um, scheduling those study areas right there. Currently, they are study pods that were renovated recently and voted by students as well to increase the comfortability. And also the library has updated news and catalogs and journals of optometry and eye care news currently in the world, as well as the library also has study rooms that can be booked online and 3D printer services as well. The Hayes Center for Practice Excellence was actually donated by Dr. Jerry Hayes and his wife in 2005. It's an alumni donated program where it's focused and its mission is to help optometry students to navigate the world of optometric business. So students in classroom and in clinic may be great, but sometimes they lack that guidance of how to open a business or deal with the insurance and financial aspects and hardships that comes with having a private practice. So the Hayes Center does a great job at connecting students at SCO with alumni and private practice owners in the area to get more exposure and networking opportunities, as well as Hayes Center help students as well apply for residency programs, evaluate certain contract offers. They help with mock interview conductions and also having resumes and cover letters done. Hayes Centers help students in all aspects. And this is the 11th floor, the student service area. This is where, if you're a student ambassador, you will spend a lot of time speaking with Sunny, and you also will have the opportunity to see the president's office during your tour. And yeah, this is the tour of the tower.
Perfect. Great job, Taylor. So I'm going to take over now and start to talk about the eye center and more of the clinical side of SCO. So yeah, we'll go to the next slide. So the eye center is our flagship clinical care facility. It opened in 2002 and is one of the most premier optometry school or optometry clinics in the country. As a private optometry school, we're dedicated to just eyes, and so our clinic can dedicate itself to much more specialized areas of optometry, which is super cool. It's about 50,000 square feet, and in the eye center, you can work through different suites in your time as a student, including adult primary care, pediatric primary care, advanced ocular disease, surgical services. We have contact lens, vision therapy, all kinds of super specialized areas of eye care, and it gets you exposed to all kinds of sort of practice modalities within the clinic. We also have an advanced procedure suite, which is pretty cool. We'll see some pictures of that later. And we serve thousands of patients a year. Around 400 to 450 patients per day. And you as a student, get to see your own patients throughout that time that you're a clinician at the school. We don't really do a whole lot of sharing patients because we have such a large patient base that students get to see their own patients, which is super exciting. Okay, so this is the lobby of the eye center. This is where check-in happens and check-out in the waiting room. So you can kind of see at the desk there. Patients will walk in and check in, and then we have staff at the eye center that are dedicated to making sure that we're doing our billing and coding right. So you get experience in that aspect of eye care, and that's kind of all that happens really in the lobby. Just kind of a waiting area, but it's a really nice spot. So primary care, adult primary care is what you get your initial clinical experience in at SCO. It has all of the primary care suites have a similar layout to all of the other suites in the eye center. So we have 4 exam rooms centered around 1 staff doctor. So we work on a 4-to-1 student to doctor ratio, which is super helpful as you're learning to become an eye doctor. In adult primary care, we see patients that are over 19 years old, and it's just sort of the routine eye exams and sort of the stuff that you can kind of use to get your feet wet. So you start that in your 3rd year, seeing actual patients, real people, and treating them as a doctor. So this is the advanced procedure suite that we were talking about. It's a super exciting area that's kind of newer to the eye center. So this is where we one of the most exciting parts of optometry right now is that there are scope expansions happening all over the place in different states, and not every state has the same scope of practice. But at SCO, we are taught to the highest standard, the highest scope of practice in the country. So even if things aren't necessarily within Tennessee's scope of practice, where we're taught to, potentially go practice in any state, we're taught to the highest scope. And so we actually get hands-on experience doing minor laser procedures, which are available to optometrists in certain states, dry eye treatment, lumps and bump removals. So in this sort of advanced procedure suite, there is a viewing gallery, which can display an advanced procedure that's taking place in the suite. And then we as students get the chance to go in and watch advanced procedures as they're happening live and get experience both watching and actually performing these advanced procedures in your time as a student, of course, under the supervision of an optometrist or ophthalmologist. And in this suite, we also learn about pre and post-operative management for cataract surgeries and things of that nature. Vision therapy. So if you're not familiar with vision therapy, it's sort of like physiotherapy for your eyes. So we have 2 eyes, and sometimes the 2 eyes don't want to work together. They want to work in isolation of each other, and that's pretty confusing on our brains. So in vision therapy, you can see in these pictures, it kind of looks like they're just kind of playing video games and stuff. But they're all exercises that you get to learn to help the eyes work together and talk in a more unified way towards the brain, which is super cool. It's super useful in treating traumatic brain injuries, learning, reading issues, and there's a significant amount of overlap between the vision therapy clinic and the peds clinic, because a lot of children have trouble keeping their eyes moving together as they should. So the practice suite for board exams, we have 2 of these in the eye center, and they're made in the likeness of what were the exam lanes that are used for part 3 of the national board exam that you take in your 4th year. So that I believe that section of the board exam, the part 3, has changed. So these lanes won't necessarily be used in the same way that they were initially intended, but it's a super great resource to go in and get practice. They're equipped with cameras that will record an exam for you so that you can play back and see what kind of things you did well or did poorly, and you can really kind of hone in a lot of your clinical skills and use it as really great practice before doing that practical aspect of the part 3 board exam. So of course, one of the super important parts to being an eye doctor is treating people with glasses. And so SCO in the eye center has its own optical that you get the chance to work throughout your third and fourth years. So this sort of gives you the full scope of what optometry can look like. If you wind up in a practice where you're selling your own glasses, you need to learn how to fit glasses to patients' faces, and you have to learn to make sure that the lenses that you get come back from the lab properly, and you're actually giving the patient the correct prescription, and all of those fun things that go along with dispensing glasses. So that's one of the really great programs that SCO provides to us is we get to learn that side. It's not purely clinical, but we also get a chance to work in the optical. SCO cuts all of its own lenses, so we kind of get to see the making of a pair of glasses from step one to the time they walk out the door with the patient. And it's really beneficial. You rotate through the optical, I think, once per week in your third year, 1 out of the 3 days that you work in clinic every week. And it's a pretty cool experience to get to see a pair of glasses go from start to finish. So pediatrics is a super fun area of the clinic. So we have this area that's completely dedicated to children. So we see anywhere from infancy to 12 years of age in the pediatric clinic. And peds is a little bit different from, say, adult primary care, because children are all in different stages of development and different needs as far as eye care goes. So this area of the clinic, though it looks pretty similar, it does have a lot of stuffed animals and things to picture books to make kids feel more comfortable. And you kind of get to learn a different side of optometry, where you may not be, you may have to do a little bit more out of the box thinking to get the information that you need from the kids, but it's a super fun and a great bit of experience to have while you're still at school before you go and set up practice where you're going to have to start seeing kids anyway. So ocular disease is a service where you really get to hone in on people that are coming in for much more follow-up care, have a lot more specific needs for their eye care. These aren't people necessarily that are coming in just to get a new prescription for new glasses. Typically, they have some pretty serious ocular conditions going on, and you get to learn how to work with and treat and manage a wide variety of ocular health conditions. Memphis, where the school is located, is not necessarily a very health literate area. So we get to see a lot of patients who have perhaps ignored their ocular health for a long time and, just figured they should come see the eye doctor now after 30 years of not having an appointment. And things can be, very challenging because they've let disease progress for so long. So in the ocular disease suite, we get to learn how to manage patients with these conditions, and also have the challenging conversations of, what this person's quality of vision will be now for the rest of their lives with irreversible vision loss. And it's a very important skill to have as a practitioner. So it's a great thing that we get at the school. So now talking about our external clinics. So the eye center is the clinic that's on campus. And we see about 90% of our total patients in the eye center on campus, but we do have 2 other external clinics, one being Focal Point in the Crosstown Concourse here. I think the next slide is on Focal Point. Yeah, so Focal Point opened in 2017 inside the Crosstown Concourse. Those who aren't familiar with the Memphis area, that's an old Sears distribution center, which has been turned into a place that has all kinds of restaurants, condos, shops, etc. And so we have a location set up there that has a much more boutique style selection of eye care. We have lots of digital technology in this location, which is a great way to get your hands on some of the technology that you can use in practice when you graduate. It's an 8,000 square foot clinic. And it's also the area where we do most of our dry eye treatments for people with particularly dry eyes. University Eye Care Center is another one of our external clinics. It's located on the University of Memphis campus. And with these external clinics, you begin your rotations through them in your fourth year. And so it was our first satellite campus that we opened back in 2013. And it has 4 exam rooms, opportunities for sports vision through the University of Memphis, get to work with their student athletes, which is super cool, and enables us to serve the faculty, students, and staff of the University of Memphis. And SCO is also launching its first kind of telehealth care program to get exposure to that sort of side, which is becoming more prevalent through optometry.
Alrighty, so thank you both so much for that incredible walkthrough and helping our attendees get a much better sense of the campus and the college and where they might be spending the 4 years of their education here at SCO. So now we're going to open it up to questions from our attendees. Again, you guys feel free to use the chat feature or the Q&A feature. You should be accessed via the bottom of your screen. And any questions that you have, we'll be able to share with our 2 student ambassadors. But I guess while we're waiting for questions, this is a question for both of you, Taylor and Alex. What aspect of the SCO campus, like let's say the tower, do you feel you enjoy the most or has really benefited your education so far?
I can go ahead and start with that one, Alex. I'd say the 4th floor is definitely the best floor for me because I enjoy studying in a talkative environment and a place with natural light and place I can get a quick snack and go to the fridge, go to my lunch bag. I would bring a lunch bag to school and leave it in the fridge and grab a snack as I'm studying with my friends and my lab group classmates as well. So I think 4th floor also has study areas and outside seating as well as a bathroom right away. So I think 4th floor definitely is the best.
I think that's a great answer. For me, I would say that I really like the theory and methods labs that we have on the 1st floor. I think the reason I say that is because obviously when you get into those labs, you really get to start to feel like a doctor even before you are one, which is super exciting. From day 1, week 1, you get to be doing sort of a fun way to figure out somebody's glasses prescription without even asking them any questions. You can just kind of shine a light into their eye and flick around some lenses, and we get to start learning that kind of stuff right away. So that was super cool when coming to SCO to kind of get that hit the ground running and start to learn some clinical skills. And then since then we've continued to build on them, and having that lab there where you can practice outside of lab time. It's open for us to use outside of our lab times and practice and get extra work in on skills that you aren't confident in yet. And I think having that resource there is just incredibly beneficial. So I would choose the 1st year teaching labs.
Thank you both so much. So we have a couple of questions that are similar. 2 attendees have asked, what made you choose SCO? And then 1 attendee asked, what are your favorite parts about the SCO school and community? So maybe you can both start off with why you both chose SCO and then what your favorite parts about the school and community as a whole are.
Yeah, the reason I chose SEO, big reason I chose SEO is that it was an optometry only school, and after my 1st year, it definitely paid off. I think it's really great how we can see the eye center connected to the school and have our doctors teaching us the material. I also picked SEO because of the facilities. The theory methods labs are very new and also have TAs there all the time ready to help us throughout the day whenever we need, as well as the board passage rate was also a reason why I chose SCO. And my favorite part of the community, I'd say the classmates are really close. We have group chats and we're always reminding each other of due dates and tips and certain things that I feel like other programs might not have. And also, I loved Memphis when I came to visit. I enjoyed the sports atmosphere here and just I don't know, the community and the family feeling of Memphis. Yeah.
Yeah, I'm definitely going to echo Taylor on a lot of that. So SEO has pretty incredible board scores, which certainly factored into my decision. And I guess what was really important for me and is kind of hard to explain over a Zoom call is just kind of like the atmosphere of SEO. I had the chance to interview at a couple schools when I was applying, and there was just this general feeling of SEO certainly has a family atmosphere to it. I think is the best way to describe it, and you can see that right from interview day. There was a huge difference between some of the schools I went to and SEO. Where at SEO I felt a lot more like I was being treated as somebody who they really wanted to have at the school, and they were willing to accept us all right from interview day as though we were going to be here for 4 years and it was going to be awesome. That was super important to me, because when you make the decision on an optometry school, you're committing to spending 4 years there, and you want to make sure that it's an atmosphere where people are friendly and are going to foster a great learning environment for you. And I really felt that on my interview day, and I have to say that that's continued now through and into my second year. You become so close with your classmates, and SEO has one of the bigger class sizes, which was also pretty important to me. When you have a big class like this, you have all kinds of opportunity to get practice on different eyeballs. And you don't want to be looking at the same eyes over and over because it doesn't help you grow. So by having that huge class size, that was a great way that you can develop into a better clinician, and I think that was super important. But yeah, overall, I would hammer in the fact that everybody is cheering for you at SCO. Everybody wants you to get to that finish line, and you feel that from day one.
Thank you both. Now we have another student who asked, what year did you get the opportunity to select your subspecialty? For example, specialties like pediatrics or retina. And for you two being second years, I believe this won't come until your third year. But if you want to talk on this, the process of choosing or selecting a specialty, then you're welcome to.
Yeah, I can jump in. So there isn't so much of a choice of specialty necessary. You get exposed to all of it. Like it or not, you get trained to provide full scope care, which is, I think, a great opportunity to kind of have these nooks in the clinic that are dedicated to a certain patient base, because it helps you get exposed and in the mindset of treating a certain patient base when you're in them. But as far as actually choosing a subspecialty goes, you can kind of do a little bit of that in your fourth year. So the fourth year is broken up into one internship and two externships. So in your internship, you rotate through the school's internal and external clinics in Memphis, and you get supervised by the staff doctors at the school, and you get to rotate through all of those specialty areas of the clinic. And then in your two externship sites, you get to choose spaces that don't even have to be in Memphis. In fact, most people go back to their home state or a state that they're really excited about practicing in. And you get the option to choose one large institution like a VA hospital or something of that nature, and then one private practice where you kind of get exposed to what that kind of practice modality can look like. So as far as choosing like pediatrics or retina, like you don't really choose that. You can specialize in those after school with a residency, which also isn't required, but is an option for you post graduating. And then other than that, when you're in school, you get exposed to just about everything, which is awesome. I hope that helps.
Awesome, thank you. We have a couple other questions coming in. The first one is in what year do you begin seeing or working with patients?
Yeah, I can answer that one. So as a second year student, you begin shadowing our third year students in clinic. And in third year summer semester is actually when you as a SCO student will begin to be practicing on patients.
Awesome, thank you. And then another question, are most professors still practicing doctors or are they just teachers?
Yeah, most of the professors are practicing. They work in the clinic as staff doctors. There are some staff doctors on staff who have their own practices outside of the school and then rotate through and do a couple days a week at the school as well. But for the most part, we have our faculty will be part of your didactic sort of studies through either teaching a course or being an instructor in one of your labs, that sort of thing. But most of them will also be working in the clinic as sort of a guide as you're seeing your first patients.
Wonderful, thank you. I suppose I'll ask real quickly, any last questions? Any last questions? And while we're waiting on any last question, oh, here we go. How do you feel about the organization and flow of the curriculum? And I
Uh,
suppose that's one, what, either of you? Yeah, yeah.
yeah, absolutely. So I really enjoy it. The I think they definitely kind of have it figured out, which is super comforting as a student because I feel like from in your first year you get a lot of exposure to well the basics of optometry and what you're going to need to know, but they really lay it out from a perspective of you know nobody really knows anything. Not that that's true, but they want to teach you kind of in the SCO way, and they definitely have it built up across all of the courses where the order in which they throw information at you helps you digest material better when you go along because you have sort of a first exposure in first year, and as you go along you can kind of build on that. There's nothing once you get to optometry school that you can forget, because it all becomes really relevant to managing your patients and their health when it comes down to graduation. I know when I came to SCO, I was super nervous in particular about the optics course, which you take in your first year, because that sounds like a lot of physics, and I didn't have a huge physics background. But our teacher, Dr. Jackson, he has that course laid out. He's taught it for a number of years now and has it laid out in a way where it actually became one of my best courses in the year. And I credit that to his teaching more than anything else, because he just has a way where he can digest this really complex information and spit it out in a way that makes it so much easier to digest. And I would say that holds true for most of the faculty at SCO. They really have they've seen a number of students through the years and identify trouble spots all the time and then work to make them better. So they really do a good job of that.
Yeah, just to add on that, great answer, Alex. I would say the flow of the curriculum, as a first year student, we studied really basic sciences, from building from the ground up, and in terms of our clinical skills, we learned to a whole refractive sequence, how to prescribe patients. We can already prescribe patients glasses and manage pediatric patients prisms if they have vision therapy problems, as well as managing older patients' presbyopic ads. And I know as a second year now, I can speak on how we are more focused on the eye health aspect of it. We are learning fundoscopy and getting into courses such as pathology and pharmacology. And I know that third years, for example, are by the end of third year, they're already great at seeing patients. And as a fourth year, like Alex said, they begin to look into which subspecialty they enjoy more. And if they would like to pursue a residency after they graduate. So definitely the flow and the organization of SEO is something I really enjoy and can say great things about. So
Thank you. And then we've had a few more questions come in. This one I know, Alex, you touched on a little bit, so maybe if Taylor wants to add anything to this one. What were you most anxious or scared about when coming into optometry school, and how did SEO help?
yeah, for me was probably similar. I didn't take a anatomy course prior, so I was anxious about certain courses. So yeah, so SEO did a great job at giving me all the resources and all the advice and guide to do well in that course. So in terms of um living in Memphis, SEO always did a great job at giving me the best advice on where to look for housing, and also on campus they did done a great job at um, keeping me feel safe as well. So I'd say um, SEO did a great job at that.
Thank you. And let's see, question from Timothy. For neurological optometry, is it more centered with head trauma or is it a large scope? If either of you all have had experience with that in your coursework yet, you can comment.
I don't think we've done a whole lot with this yet. I think a lot of it comes down to traumatic brain injury. I know we take a neuro optometric course in the fall of this year, so I can't give you a whole lot of specifics. I don't know if you can, Taylor. I know it is, we do have an entire course dedicated to it. And then also in your third year, when you're doing seminars prior to boards, that's an option for one of your seminars is additional content on sort of neurooptometry. So I know there certainly is a ton to it. I'm just not sure how to specifically answer that question. I don't know if Taylor, you have anything else.
No, I'm not too sure as well. Sorry.
No worries at all. Okay, and for that student, if you do have any specific questions like that, feel free to follow back up with our admissions department, and we should be able to maybe direct you to a member of our faculty or an upperclassman who can provide a little bit more insight. Okay, and then the last question I'm seeing, have either of you been able to work with the Memphis athletes through the sports vision specialty? Since the second years, this probably won't come up until your third year or fourth year, but do either of you have an interest in working with Memphis athletes through the sports vision specialty?
Yeah, so we have a sports vision club here at SEO, and we do vision screenings on athletes, and the club always has presentations and goes into detail on the scope of practice, the opportunities the optometrists have in the sports vision area. So yeah, definitely Memphis and SEO. SEO does a great job with vision sports. So
Wonderful, thank you. I guess I'll do my last call for any questions. Last call for questions. No, okay, not seeing any. Well, if you do have any other questions for our attendees, feel free to reach out to myself, Taylor, Alex, anybody in the admissions department, and we'd be more than happy to address any and all questions you may have. Alrighty, so this brings us to the end of our webinar. I know we have covered a lot of information tonight, but I do hope this has been of assistance to you all as you start on your optometric journey. Our next webinar will be an introduction to the different specialties within optometry brought to you by current residents, and registration links should be live on our website next week. If you haven't done so already, I invite you all to request more information by signing up for our inquiry form. You'll receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you so much to Taylor and Alex for sharing of your time and experiences, and a special thank you to all of the attendees who have joined us. We hope to see you all at the next webinar in August, but in the meantime, have a great rest of your week and take care.